Chapter 16. Handle T1D emotionally. Finding out that you, a family member, or a child have diabetes is a huge shock, to say the least. The most important thing is to always be honest with yourself. Discuss your feelings with your partner, family, or friends. You need to face your own insecurities, feelings, and fears. It is important to be emotionally present to what your body and mind is thinking and experiencing. You will have a range of emotions when you have been diagnosed with type 1 diabetes. All the stages of grief will be experienced as you realize that your life has now changed as you know it. Saying goodbye to your old habits and lifestyle might be daunting. Some of the feelings can range from, or a combination of, isolation, denial, depression, guilt, anger, fear, and embarrassment. It is important to identify these feelings and handle each and every one of them. You might feel isolated because you are the only one with T1D in your family, class, or group of friends. You might not know other people with T1D, and by joining groups on social media and finding support groups in your area will help you not to feel alone and isolated. You can go through a denial phase where you want to feel like people not affected by T1D. This might prompt you to skip blood sugar testing or injecting insulin. This could be dangerous and allow the blood sugar to spiral out of control. Another emotion to look out for is feelings of depression, sadness, and hopelessness. It is important to feel reassured of unconditional love and support. If you struggle to get out of this stage, it might be advisable to look for professional help. This might help you to be guided through the depression. You might also feel guilt. When you show signs of guilt for being a burden on your family, it is important to be reassured that you are in this together and nothing they did caused this. You could also feel anger because you have to keep to the strict system of your blood glucose control management. When you feel fear or anxiety because of blood sugar control problems, needles, and the potential for long-term health problems, know that out-of-control blood sugar is only temporary and can be corrected. Long-term complications can be avoided, and the needles are designed to be as pain-free as possible. Testing and injecting is nothing to feel embarrassed about, although you might feel so when you test in public and receive unwanted attention. Educating people is the first step of creating a safe and supportive emotional environment for yourself. People will accept it when they understand it. Whatever feelings you might have, know that there will be ups and downs. Keep communication open and talk to your family. Be sure to check in regularly about your feelings. This will help not to keep it all bottled in or hide your feelings, worrying that you are a burden. Know you are stronger for facing this and build on that premise. Realize that T1D is not an anchor dragging you down, but a crane helping you to reach new heights. It is hard to come to terms with the idea that you have a chronic condition that needs management for the rest of your life. You might also feel guilty and wonder if you caused this and how you could have prevented it somehow. You couldn't have. Your partner or family might also feel unsure about how to take care of you or how to handle your meals or recognize symptoms associated with diabetes and getting you the right medical help if needed. You are not alone in having all of these feelings. Get answers to your questions by talking to healthcare professionals. Educate yourself about diabetes by reading articles and joining online support groups. Also, ask the care team for information and tips on coping with your emotional issues. It's important to see your own needs and deal with your own feelings. Allow others, like relatives and friends, to be part of your journey. Empower them with knowledge about T1D. Remember, you can do this. You will find that people in similar situations are always willing to help and support you. It is important to remember that these groups are there as a support structure. Do not make changes to your treatment plan as a result of advice from a support group. Only make changes on recommendation from your doctor or diabetes care professionals. You might find it easier to talk with a counselor, your doctor, or others on the diabetes healthcare team about these emotional issues. Also, consider looking for support groups, books, and websites about how to deal with diabetes. Motivate yourself to keep up active healthcare management. Remember that you can avoid complications. It can be hard, especially at first. But it's important to resist the urge to lower your expectations of what you expect yourself to achieve. Build your strength and invest in your own mental health. Spend time on your passions, since this defines you, not your condition. Focus on friendships. Having fun with friends builds confidence and a sense of belonging. Discuss your condition with your friends. Correct misconceptions whenever you come across them. Knowledge is strength, and from strength, greatness is born. Connect with T1D groups. These groups can boost your confidence as you deal with diabetes and offer advice and tips on managing it. The diabetes healthcare team might be able to help you connect with support groups in your area. Get help when you need it. Be sure to keep your diabetes healthcare team in the loop about any emotional issues. They deal with this all the time and can provide help and advice for you. If you show any signs of depression, such as lasting sadness or irritability, tiredness, appetite changes, or change in sleeping habits, talk to your doctor or a mental health professional. Some things to remember when dealing with your child. Check in with your child regularly. Try to listen to everything he or she has to say before bringing up your own feelings. This kind of communication doesn't always have to be verbal. Drawing, writing, or playing music can help kids with diabetes express their emotions. Encourage active healthcare management. Reinforce the idea that when kids take care of themselves and manage their diabetes, they can avoid complications. Let your child ask the doctor questions on his or her own. Build independence. It can be hard, especially at first, but it's important not to lower your expectations or overprotect a child with diabetes. Instead, encourage the same independence that you'd expect from your other kids. Help your child find his or her strength. Take what they are passionate about and build on that. Let their passions define them. Focus on friendships. Having fun with friends builds confidence and a sense of belonging. Encourage your child to discuss diabetes with friends. Correct misconceptions. Talk to your child about diabetes and some of the misconceptions. Make sure that they are confident in correcting someone, telling them your parents gave you too much sugar. Help him or her prepare their responses to address the coming misconceptions. Connect with others dealing with diabetes. Finding a support group for kids and families with diabetes can help kids to feel less different. These groups can boost your confidence as you deal with diabetes and offer advice and tips on managing it. The diabetes healthcare team might be able to help you connect with support groups in your area. Get help when you need it. Be sure to keep your child's diabetes healthcare team in the loop about any emotional issues. They deal with this all the time and can provide help for your child and advice for you. If your child shows any signs of depression, such as lasting sadness or irritability, tiredness, appetite changes, or changes in sleeping habits, talk to your child's doctor or a mental health professional. Every parent of a child with diabetes must deal with the feelings that come with the condition. Try to keep in mind that for most kids, negative feelings about diabetes pass or change with time as they adjust to living with it. Have a look at the resources posted at the end of this section for more information on handling type 1 diabetes emotionally. In the next chapter, we will discuss managing your child's school routine.